Good morning, wherever you are. This is Miles Carter from ConferenceHype. Our segment will focus on evaluating toxicity and interaction outcomes of systemic therapy and stereotactic ablative radiation therapy for oligometastatic disease, a secondary analysis of the Phase 2 SABR-5 trial. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: although stereotactic ablative radiation therapy is known for low toxicity and safety, its combined use with specific systemic therapies requires further investigation. Methods: a secondary analysis of the SABR-5 trial evaluated grade 2+ and 3+ toxicities post-SABR in patients who had received high-risk or non-high-risk systemic therapies before SABR at 4 predefined intervals. Concurrent with SABR, 1 day to 1 week prior, 1 to 2 weeks prior, or 2 to 12 weeks prior. Results: among 380 patients, grade 2+ toxicity rates were 17.3% off systemic therapy, 19.2% on non-high-risk therapy, and 42.9% on high-risk therapy concurrent with SABR. Discussion: concurrent use of high-risk drugs has demonstrated a potential of increased SABR-related toxicity, warranting caution in their concurrent use with SABR. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: in the PACE-B study, a non-randomized comparison of toxicity outcomes between stereotactic body radiation therapy platforms revealed fewer urinary side effects with CyberKnife compared with conventional LINAC SBRT. Methods: this analysis compares baseline characteristics and planning dosimetry between the CKSBRT and CLSBRT cohorts in PACE-B, aiming to provide insight into possible reasons for differing toxicity outcomes between the platforms. Results: of the 414 patients who received SBRT, 169 were treated with CKSBRT and 245 with CLSBRT, with dosimetric parameters available for 94% of patients. Discussion: although the CKSBRT cohort showed lower urinary toxicity, the planned doses to urinary substructures were actually higher, likely due to heterogeneous dose planning. From the 2026 Jun 1 edition of International Journal of Radiation Oncology Biology Physics. Background: this study evaluated late ureteral toxicity in relation to dose in patients treated with stereotactic body radiation therapy on abdominopelvic lymph node oligometastases and assessed differences between planned and received ureteral dose. Methods and materials: patients treated between 2011 and 2023 with SBRT on AP-LN oligometastases from various primary tumors were retrospectively reviewed. Results: the study included 144 patients, of whom 121 had a total of 137 ureters that were treated with 10 GI. Discussion: the incidence of G3 ureteral toxicity after SBRT on AP-LN oligometastases is low. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: there are limited data on outcomes in patients with ultracentral pulmonary oligometastases treated with SABR. Methods: oligometastatic lung lesions treated on the single-arm Phase 2 SABR-5 trial were retrospectively stratified into 2 cohorts: ultracentral tumors, defined as planning target volume overlap or direct tumor abutment to the proximal bronchial tree, esophagus, great vessels, or heart, and non-ultracentral tumors. Results: in total, 41 patients with 45 ultracentral metastases and 93 patients with 172 non-ultracentral metastases underwent SABR. Discussion: in this prospective patient cohort, SABR for ultracentral tumor had low toxicity rates and good local control.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: pembrolizumab is approved for PD-L1+, but not PD-L1 negative metastatic, recurrent, or persistent cervical cancer. Methods: response rates to single-agent anti-PD-1, PD-L1 therapy have been modest with no responses noted in PD-L1 negative tumors. Results: a total of 21 patients were enrolled. Discussion: in this first trial of SBRT and atezolizumab in metastatic cervical cancer unselected for PD-L1, combination therapy was well tolerated. From the 2026 July 24 edition of International Journal of Radiation Oncology Biology Physics. Background: the Imaging and Radiation Oncology Corps works with the Children's Oncology Group to provide institutional credentialing and patient radiotherapy plan review for sites that enroll patients on COG clinical trials. Methods: COG protocols that include radiotherapy require specific site credentialing activities, depending on the treatment technique that is allowed in the protocol. Results: this study found that credentialing and case reviews in clinical trial quality assurance were complementary, identifying unique failure modes, often before they affected enrolled patients. Discussion: while the final rate of protocol deviations was low for COG protocols, many errors were identified through the case review and credentialing processes, highlighting the continued need for quality assurance checks of radiotherapy data in clinical trials. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: to assess the safety of using combined gallium-68 prostate-specific membrane antigen positron emission tomography, computed tomography, and multiparametric magnetic resonance imaging for planning dominant intraprostatic lesion boost in prostate stereotactic radiation therapy for dose escalation. Methods and materials: patients with intermediate or high-risk prostate adenocarcinoma with DIL identified on MP-MRI and 68 Ga PSMA PET-CT and suitable for SBRT were enrolled in this Phase 2 trial. Results: 30 patients were enrolled. Discussion: boost volumes on 68 Ga PSMA PET-CT and MP-MRI were volumetrically similar, however, with poor spatial concordance. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: the Mirage, magnetic resonance imaging-guided versus computed tomography-guided stereotactic body radiotherapy for prostate cancer. Trials showed that aggressive planning target volume margin reduction, achieved by leveraging the advanced image guidance of magnetic resonance imaging-guided radiation therapy, led to lower toxicity after stereotactic body radiation therapy to the prostate compared with computed tomography-guided SBRT with a standard PTV margin. Methods: it is unknown whether the dosimetric benefit of reducing PTV margins, alone independent of the other components of advanced image-guided radiation therapy that allowed margin reduction, would be predicted to replicate this decrease in toxicity. Results: compared with MRG SBRT patients, replanned CTG SBRT patients had similar or statistically significantly improved rectal dosimetry and similar bladder dosimetry. Discussion: reducing PTV margins for CTG SBRT plans produced similar to improved organs at risk dosimetry compared with the clinical MRG SBRT plans, which in turn would be predicted to reduce toxicity when compared to larger margin CTG SBRT plans.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: we hypothesized that treatment with radium-223 and stereotactic ablative radiotherapy in patients with bone-only metatronous oligometastatic hormone-sensitive prostate cancer could safely delay the start of androgen deprivation therapy and maintain quality of life. Methods, and materials. This prospective trial included 20 men with MO-HSPC and less or equal to 5 bone-only metastases who previously had definitive treatment to the prostate and pelvic lymph nodes. Results: the median number of Ra-223 cycles was 6. Discussion: in this Phase 2 trial, the initial use of Ra-223 and SABR for MO-HSPC significantly delayed ADT use compared with historical controls. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: optimal management of oligoprogressive prostate cancer while on androgen receptor pathway inhibitors is not known. Methods: the TRAP trial tests the role of stereotactic body radiation therapy in this setting. Results: 86 men were recruited between October 2018 and February 2023. Discussion: the TRAP trial has demonstrated a median PFS of 6.4 months after SBRT for oligoprogression of prostate cancer, meeting the primary endpoint. From the 2026 May 1 edition of International Journal of Radiation Oncology Biology Physics. Background: metastasis-directed therapy for oligometastatic renal cell carcinoma with stereotactic body radiation therapy has been shown to improve progression-free survival and delay time to systemic therapy. Methods: here, we present long-term follow-up of a prospective trial. Results: 15 patients, all with resected primary tumors, 40% prior systemic therapy, 47% International Metastatic RCC Database Consortium intermediate risk. Received SBRT to 23 lesions of 100 GI, 43% lung, 35% abdomen, 17% bone, 4% head and neck. Discussion: multisite SBRT and oligometastatic RCC offers excellent local control with a low risk of severe late toxicity. From the 2026 July 22 edition of International Journal of Radiation Oncology Biology Physics. Background: minimizing radiation-induced lymphocyte kill, a key immune-suppressive effect of radiation therapy to augment tumor-specific immunity, is timely and important. Methods: we conducted a single-institution Phase 2 randomized trial enrolling 51 early-stage NSCLC patients to be treated with SBRT to evaluate the effect of dose reduction to immune-rich organs on RILK, focusing on lymphocytes as primary immune cells. Results: average percentage reductions in integral dose, V5, and V10 to heart, lymph nodes, and thoracic vertebrae in the optimized arm versus standard arm were 21% 68%, 37% 68%, and 57% 92%, respectively. Discussion: significant RT dose reductions to immune-rich organs in lung SBRT with comparable safety is achievable, markedly preserving lymphocytes compared to standard of care. This is Conference Hype. Stay with us, coverage continues. That's it for now for Conference Hype's coverage of the July 2026 issue of International Journal of Radiation Oncology Biology Physics. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.